Salam, hi, I am Dr. Asad Saleem. Let's begin. Cellulitis. It is a common bacterial infection affecting your skin. It specifically targets the deeper layers of the skin. These layers are known as the dermis and subcutaneous tissue. This infection can also involve the tissues beneath the skin. While cellulitis can appear anywhere on your body, it most frequently occurs on the lower legs. Understanding this condition is very important for your health. Prompt medical attention can prevent more serious health problems from developing later on. This skin infection can range significantly in its severity. Some cases might be quite mild and resolve easily. However, if cellulitis is left without proper treatment, it can become very serious. It has the potential to lead to life-threatening complications. These complications could include sepsis, which is a severe body-wide reaction. Deeper infections like bone infections are also possible. Therefore, recognizing the early signs of cellulitis is absolutely key for effective management and a good outcome for patients. The main cause of cellulitis is bacteria entering your skin. This usually happens when there is a break in the skin's surface. These breaks can come from various sources. Common examples include cuts, scrapes, or even insect bites. Surgical wounds, if not cared for properly, can also become entry points. Sometimes the break in the skin is incredibly small. It might be so tiny that you do not even notice it. Skin conditions like eczema or athlete's foot can also create these openings. Once these bacteria manage to get inside, they can begin to multiply. They often do so quite rapidly if conditions are favorable. The infection then starts to spread through the skin's layers. It typically moves through the dermis and the underlying subcutaneous tissue. As the bacteria grow, they release toxins into the surrounding area. These toxins cause damage to the tissue. This damage and the body's response lead to inflammation. This inflammation causes the visible signs of infection we see. The common signs and symptoms of cellulitis are usually quite noticeable. The affected area of skin will often appear red. It may also become swollen and feel unusually warm to the touch. Tenderness or pain in that specific area is another very common symptom. The redness associated with cellulitis can sometimes expand quite quickly. This rapid spread of redness is a clear indicator of an active infection. You might observe the red area growing in size over a period of hours or days. Other symptoms can also accompany these changes in the skin. You might find yourself developing a fever. Chills can also occur as your body reacts to the infection. Some people report feeling generally unwell or experiencing significant fatigue. In certain cases of cellulitis, blisters may form on the surface of the affected skin. Swollen lymph nodes, particularly those near the infected area, are also a possible sign. These systemic symptoms suggest your body is actively fighting the infection. Doctors typically diagnose cellulitis based on a thorough physical examination. They will carefully look at the affected area of your skin. They will check for the characteristic signs like redness and swelling. They will also assess for warmth and tenderness to the touch. Your doctor will also ask you questions about your medical history. They will want to know about any recent injuries you may have had. Information about pre-existing skin conditions is also very helpful for them. While the physical examination is often the key to diagnosis, other tests are sometimes used. Blood tests might be ordered by your doctor. These tests can help check for general signs of infection in your body. For example, a high white blood cell count can indicate an infection. A wound culture or even a skin biopsy is sometimes performed. This involves taking a small sample of skin or fluid from the affected area. This sample is then sent to a lab to identify the specific bacteria. If your doctor suspects that you have cellulitis, treatment usually begins immediately. The primary treatment for this bacterial infection is a course of antibiotics. These important medications work to kill the bacteria causing the infection. It is absolutely vital to start taking antibiotics promptly once cellulitis is diagnosed. Any delay in starting treatment can allow the infection to worsen. It could also spread further and potentially cause more serious complications for your health. Always follow your doctor's advice. Antibiotics for cellulitis can be administered in a couple of different ways. For most cases that are considered mild to moderate, oral antibiotics are effective. These are usually pills or capsules that you take by mouth. This treatment typically lasts for several days, often a week or more. More severe infections, however, might require intravenous IV antibiotics. This method delivers the medicine directly into a vein. IV treatment is often administered in a hospital setting for closer monitoring and care. Hospitalization may become necessary for individuals with severe cellulitis. This is particularly true if the infection is spreading very rapidly. It's also common if you are experiencing a high fever or other serious symptoms. Patients who have weakened immune systems might also need hospital-based care. In the hospital setting, powerful IV antibiotics can be administered efficiently. Close monitoring of your condition is also possible in the hospital. This ensures the treatment is working as expected. Besides antibiotics, there are other important measures that support healing. Elevating the affected limb can significantly help to reduce swelling. This elevation can also help to alleviate some of the pain. Over-the-counter pain relievers, such as ibuprofen or acetaminophen, can manage discomfort. Keeping the infected area clean and dry is very important. If there are any open wounds or blisters present, proper wound care is essential. Your doctor or nurse will provide specific instructions for this type of care. Your diet can also play a supportive role in your immune system's function. While diet is not a direct cure for cellulitis, good nutrition helps recovery. Focus on eating a well-balanced diet that is rich in fruits and vegetables. These foods provide essential vitamins, minerals, and antioxidants. Staying well hydrated by drinking plenty of water throughout the day is crucial. Some research suggests that foods with anti-inflammatory properties might be beneficial. Consider incorporating items like fatty fish, nuts, and olive oil into your meals. Early detection and prompt treatment are absolutely paramount for cellulitis. Addressing the infection early greatly improves the overall outlook. It also helps to prevent potentially serious complications from developing. It's crucial to finish your entire prescribed course of antibiotics. Do this even if you start to feel better before the medication is finished. To help prevent cellulitis from recurring, practice good skin hygiene daily. Keep your skin well moisturized to prevent it from cracking and creating entry points for bacteria. Stay updates on medical and health insights on your channel at Asad Saleem, 1414 on YouTube. Make sure subscribe it and press bell icon for more information.